All right, and I think I've got our slides up. Okay, well, I apologize. I do have dual screens, so if you see me look away, it's just checking out my my other slide here. So first of all, thank you so much, everyone, for being here today. On behalf of SRNA, we really do appreciate your attendance, and thank you to Dr. Pardo and Dr. Sadowski. You've put some incredible hard work and organization into these sessions, and it's really amazing what it's done thus far. So I know I've heard directly from some of our families already about these sessions and how valuable they've been and will continue to be in the future. So thank you. And thank you for including myself and Gigi today. So we've been tasked with the discussion about advocacy and AFM, something that we know and understand that this particular group of families is incredibly familiar with. Advocacy, as we know it, is the act or process of supporting a cause. It's the profession or work of an advocate, the action of advocating, pleading for, or supporting. And advocacy is powerful, it's important, it's necessary for change. And the most powerful advocates are those we know with firsthand experience and knowledge. And that's you, that's our families, it's the parents, caregivers, it's our kids and individuals diagnosed with AFM. It's also our medical professionals and scientists. It's our public health officials, those who understand and make these disorders a priority in their practices, their research and surveillance. It's SRNA as an organization that is representative of the entire community. So we hope that our efforts to educate, investigate, and support AFM are something that you can utilize as tools. And that's exactly how we approach our advocacy from SRNA, is via education, support, and research. It's a central point of our mission, and it's one that we do on a daily basis at our organization. And we hope that it helps you to be the most persuasive and compelling messengers of our shared mission. We'll start off with education, how we do advocacy via education. One thing in particular, we do provide our disorder information sheets. We do have one very specific for AFM. It's available on our website, and it's also one that can be created into a PDF, so you can download it and share it with others. It has been revised twice already. Obviously, there's a lot of information that is changing. We're constantly reviewing, updating, and our info sheet is currently being reviewed yet again and is going to be going through some revisions. And something very important to note is that all of our website and printable communications that are available on SRNA are reviewed by members of our medical and scientific council. This is incredibly important, especially in advocacy. We want the most accurate, up-to-date information we have. Many families provide these info sheets directly to healthcare professionals who are going to be looking at them and reviewing them, and we want to make sure that they are accurate. Next, we have peer-reviewed scientific research summaries. So obviously, there's a lot of research happening, and those often end up in medical journals, not something that's always accessible to all of those in our community. So when we know of those, when we have them come through, we do publish them, we do a summary, and we publish them in our newsletter, our blog. We do have space for them on our website as well. And these summaries make them more accessible to our community, put them in a language that is much easier to understand if someone does not have a medical or scientific background. So our resource library. Right now we have over 460 publications, podcasts, symposia videos, including these from the AFM Symposium, our newsletters, and other external resources are located there as well. At present, 276 are specifically for and relatable to acute flaccid myelitis. So there's absolutely an opportunity to retrieve information that you can take and share with your providers your families, your schools. There is a lot of information in our resource library, and it can be viewed by topic as well. So continuing in education, we also offer our Rare Neuroimmune Disorders Symposium. This is available to everyone in our community. So it's not just for families, not just for medical professionals or scientists, it's for everyone. And since 2015, we have had lectures that have been very specific to AFM, and they've been specific and included in every RNDS since that time. 2019, just last year, we also had specific AFM sessions, and we had a family, a young man included in our patient panel. It's very important to us that our community hears directly from those who have been impacted. And so we did include an AFM diagnosis in our patient panel, and the additional panel we had that also included representation from public health. NIH and CDC did join us at Symposium, and we had very frank and great discussions about what is happening in AFM from all sides of the table, including parents who spoke about their experience. Our Ask the Expert podcast series is a community-driven and very specific topic educational initiative. We have many in our resource library, and there are oftentimes things that are very related to all of the disorders that SRNA advocates for, but we do have specific podcasts for AFM as well. The very first AFM podcast, specific podcast, was in 2014, and that was held with Dr. Greenberg and Dr. Schreiner. And that was directly in response to the outbreak that we were seeing. We've had family members as well as public health officials join us on our various podcasts to hear their very different experiences with AFM and what's being done as it relates to public health and AFM. So we've even had family members actually join us as volunteer moderators. I know we had a parent join us for nerve transfers in interviews with various physicians who are conducting that treatment that's very specific and unique in AFM. We're actually planning a special AFM podcast series that's going to begin next month, and it's going to go through the summer and fall, and that'll be in collaboration with different AFM working group members, the AFMA, and public health. We also have our SRNA magazine. This is something that you can subscribe to via email. It includes the latest information about our programs, includes community member stories, upcoming events, news, research, you name it, it's in our magazine. And we have featured a few different AFM family stories. And if that's something that any of you wish to be included in, we welcome your stories and your articles for our magazine. Our blog, weekly posts come out of our blog, and these are sometimes the same things you may find in the magazine, but you're also going to see different stories. You're going to hear more. There may be announcements, some different information about events, and also urgent information, maybe a call to action. So for instance, we did do a call to action on contacting your congressional leaders regarding research funding for AFM. That is something that we put out via our blog and email, and hope to do again in the near future. So you can subscribe to our blog via email in addition to the newsletter. So one of my favorite and very personal educational ways we advocate is via our family camp. It's an incredible opportunity. It's very unique and allows us the ability to bring our kids and our families from the rare neuroimmune disorder spectrum together. And we've had families affected by AFM join us for as long as we've held camp. But we did have a large group last year that were able to come and connect with others that they may not have connected in person with before, as well as kids with other disorders. It's an amazing time. siblings are included, the parents are included, and one thing that makes it very unique is that you have access to the medical professionals who are working in these disorders, and we have the ability to be able to learn from them, but that just doesn't go one way. They're also learning from our families and our kids, seeing them in a very non-clinical setting, and it has been incredible to watch how that all transpires and comes together each year. So this is one of my favorite pictures. And I have to say, I really miss CCK and all of our families right now. So a photo of some of our AFM families that actually attended camp last year. So know these individuals, and they're all amazing. Another way we advocate for AFM is through our support, and we support in various ways, such as our walk, run, enrolls. We've had several that have been organized by AFM parents with the goal to raise awareness, fund education and research opportunities for AFM and the other rare neuroimmune disorders, and also to inform local communities. It's still something that people have no idea exists, what it is, how it happens, why it happens, or who it happens to. So we currently are virtual for our walk, run, enrolls this year, and we already do have AFM families who have started their campaigns for their teams to continue to raise that awareness and fund that education and research. So we also support via our collaboration and partnerships with other organizations. This helps us to increase awareness and support opportunities. So NORD, or National Organization for Rare Disorders, is actually one of our long-term partnerships, and we do inform them of all of our various events and podcasts. So we're able to broadcast to a larger network and get some more traction in that manner. AFMA, Acute Flaccid Myelitis Association, the parent group, allows us the ability to connect people with other families who've been diagnosed, and they also offer support, direct financial support via their scholarships and grants for various things such as equipment and therapy. Our myelitis helpline is an online resource that helps someone kind of navigate our website, answer individual questions for you, and really takes you through all of the various possibilities that there may be questions on, and it gets some wide use. So if you ever have any questions and you want to check it out, you're not sure exactly what to look up, feel free to use our myelitis helpline. We do have our support group network that is worldwide, and we are able to connect individuals with others who have been trained as support group leaders to speak with families, to speak with individuals. And if there's not someone in your area, we have a very wide membership and individuals who are willing to speak with others on an individual basis outside of a group setting. We also offer personalized support via phone calls and emails. I can say that a majority of my time is spent on the telephone. I've talked with many families over the years at various points in their diagnosis, whether it's during the acute setting, when there are questions that are being raised as far as whether or not this is an AFM diagnosis, what do they ask, who do they talk to, and all the way to, my kid's getting ready to graduate high school, what's next, what do we do? So it's a very important part of our work. It's one that I think we enjoy doing. We love to connect with you. We're all individuals who've been diagnosed or are caring for those who have been ourselves. So lastly, we have our AFM Physician Consult and Support Portal. This is one of our newer resources available on our website, and something we encourage you to share with your clinicians, with your healthcare providers. This is linked to directly by CDC as well. And what this is allowing the physicians who may have a questionable case that they're uncertain of whether or not it's AFM, gives them an opportunity to input the information and connects them directly with one of the experts who are seeing these disorders and are able to assist in that differential diagnosis. They respond within 24 hours. We have seen this be utilized. I believe even this week we've had requests come through. So it's something that is likely going to get some additional attention, and we encourage you to definitely share it so that they know that there are individuals who can help with that diagnosis. And with that, I'll turn it over to Gigi.
Okay, great. Thank you so much, Rebecca. So as Rebecca talked about, we think of advocacy as our education and the support that we provide, but we also think of our research and the training that we provide as advocacy as well. So I'm just going to quickly kind of go through what we do in these particular realms. So as an organization, our goal is to accelerate research to advance the understanding of these disorders, why they happen, their natural history, to hopefully come up with new therapies, both acute and long-term therapies, and then ultimately, of course, to improve the quality of life of those affected by these disorders, so the range of rare neuroimmune disorders that we work with. And I'm just going to talk very briefly about some of the AFM-specific research that we've conducted to date. It's included the CAPTURE study, our registry, and then a study on experiences with vaccinations. So if you want to do the next slide. Thank you. So in 2014, the CAPTURE study was launched. This was a multi-center pediatric study that was led by Dr. Benjamin Greenberg at UT Southwestern. It was for both pediatric transverse myelitis and acute flaccid myelitis. And it involved multiple health centers throughout North America, as well as we were at the time the Transverse Myelitis Association, now we're the Siegel Rare Neuroimmune Association, and of course, patients. And the study involved a survey at 3 months, if possible. Not everyone who participated was able to do the 3-month portion of this study, but also 6 and 12 months. And they also looked at the treatments received and imaging records as well. And then now, looking ahead, CAPTURE is continuing every 4 months for those who want to continue to be in the study up until 2026. So for a lot of these kids, we'll have a decade's worth of follow-up information about them to contribute to knowledge and hopefully better outcomes for those diagnosed with AFM. And then in 2017, we launched our own patient registry. So this is for anyone with any of the rare neuroimmune disorders or a patient is a patient's parent or caregiver. And so this was originally part of the NIH's Global Rare Disease Registry, but we have since when that program was discontinued, we are now doing it on our own. And it's self-reported and includes outcome measures as well as questions about treatments received, current symptoms, and potential kind of exposures before the diagnosis. And anyone who participates in the registry who has a diagnosis of TM or AFM is also able to participate in the core TM study at UT Southwestern, which is like the CAPTURE study, but for adults as well. And so far in the registry, we've had 22 participants with AFM, and so we're always looking for more. So that's all that information is available on our website as well. And then we did a lot of people in our community are often concerned about receiving vaccinations after one of these diagnoses. And so just to learn more kind of about the patient experience after one of these diagnoses, we did a study looking at whether or not people receive vaccinations after their diagnosis, and if they do, what happened, and if they don't, what are the reasons why not. And so we randomly selected 600 participants from our membership database and reached out to those folks, and of those that responded, 5 of them had were diagnosed with AFM. So we're currently doing the analysis of those data at the moment, and we'll be certainly reporting it to the community once we have that. And then lastly, we have our James T. Lubin Clinician Scientist Fellowship Award. Many of our fellows go to camp, so if any families attending have met our fellows at camp or at our symposia, but it's basically a 2-year fellowship program for neurologists after residency that want to focus on the rare neuroimmune disorders, both clinical care and research. And we think this is very important for the future of the field and making sure we have all these dedicated clinicians for our families in the future. So that's it. And then to transition, I would like to introduce our next speaker, Dr. Margaret Tenney, who will be talking about coping and adjustment and how to keep kids motivated. So thank you so much.